I think for Sayre students who work at the Sayre Health Center, it's an opportunity that connects them to real world professions that they may not have considered as possibilities, but suddenly become more real and more possible. They see doctors at work, medical assistants, they get connected to the Penn health systems. We've taken trips to the medical school where they've toured the anatomy lab and hung out with the cadavers. And that we've been to the nursing school and they've looked at the different rooms there and talked to students who go there. And I think in addition to giving them good skills, both in terms of intake skills like blood pressures or measuring height and weight, they also learn professional conduct, so how to look someone in the eye when they're having a conversation, how to answer phones politely, how to dress professionally. So so for my students, it's a job. It's an after-school job. They get paid for their work, and they're held to the standard of an employee, which I think is a good experience for high school students to have.
Definitely, yeah. What about the Penn students that work here? How do you see this influencing them and helping their time at Penn?
So we have several different. So in terms of Penn students at Sayre Health Center, we have several different kinds of Penn students here. We have community medicine clerkship rotation students, and 2 of those come a month. And I think for those students, it gives a real or community context to their education. And so instead of, and I think there is a marked difference between working at Penn and having patients come to Penn and going out and working at a community health center where patients live and interacting in that environment. So I think, well, I know because I've spoken to a lot of these students, and I know it is both singular in their, or exceptional in terms of their education because it's different than other things, and it's valuable in terms of the perspective they gain. In terms of my students, most are Penn medical students, although younger, so usually have first-year students when they have more time to volunteer time, and it's not a required part of what they're doing. Although in the summer they're called Bridging the Gap students, so it's actually an internship where they're paid to be here. I think that for any profession, working in a community and interacting with community members is valuable. I think if you're in a profession where you're going to be interacting with all different kinds of people and required to think about how to interact with all different kinds of people, I think having as many different experiences as you can is probably really important for those students. In terms of my program, I think it's important for students to talk to people that they probably wouldn't otherwise talk to, and ask questions and have real interactions. And I think it breaks down stereotypes that people might have when they can actually think about someone on 58th and Walnut Street, and they might have come here thinking one way, or people from this area might be a certain way. But I think all of that breaks down when you actually talk to people and meet all different kinds of people, and it's hard to hold on to just a single idea that you might have. And I think it's good, quite frankly, for students to take the subway to leave University City. I think that that there are markers around Penn where the neighborhood changes, and I think 58th and Walnut is out of the University City, what might be a comfort zone for students. And I love when my students often take public transportation to come up here. They have the experience of being up here and spending the day and walking around and maybe getting lunch. And we have done a lot of walking the streets this summer, and I think that's been valuable. The Sayre Health Center is a federally qualified health center that treats all patients regardless of income or medical insurance status. So we accept all kinds of insurance, but also patients who are not insured, and work on a sliding scale based on income to accommodate patients. So a doctor visit might cost as little as $15 up to about $30 or $35, I think. So that's the clinical mission of the health center, and then there's the educational mission, which is really also a core part of what we do here. And so as we've talked about, it goes to the medical students who do their community medicine clerkship rotation here, and the Bridging the Gap students, and the undergrads and graduate students who volunteer here. And then the educational mission is also to connect Sayre health students, Sayre high school students, to health professions and health profession education. And there are different vehicles for how we do that, and we're always expanding them. So this summer we're trying to build those skills, or create health profession skills through community outreach and through going out into the community and taking blood pressures. In the fall, we want to start a program where we're working on obesity prevention in elementary school students. So my interns would go out and teach classes at an elementary school about healthy eating and exercise. And we're also trying to add adult healthy cooking classes to try to start family cohorts that we're reaching both the younger kids, the high school kids, and the parents, and creating a culture around good health.